This is Late Night Health. This is the radio and video program that cares about the most important part of your life. During the next few minutes, we're going to spend some time with Dr. Greg Celaya as we talk about Graves' disease. I'm Mark Allen, and thank you for joining us. You can visit us at drcelaya.com, drcelaya.com, CELAYA.com, or latenighthealth.com. I'm Mark Allen. Dr. Celaya, thanks for joining us. What is Graves' disease?
So Graves' disease was discovered in 1830 by an Irish doctor, Dr. Grave, in Ireland, and he described hyperthyroid type symptoms. And so since then, we've called it Graves' disease when we see hyperthyroidism.
Isn't it one of the, I don't even know what to call it, classifications of the disease are deep circles under the eyes?
Yeah, well, I mean, there's many parts of it, but it is an autoimmune disease, which means your immune system is going awry and attacking the proteins in your thyroid, right? So basically, your body starts to release thyroid hormone and makes it so your body is hyperthyroid, too much thyroid hormone. Oh, bless you.
Thank you.
So
sorry about that.
So your body's producing too much thyroid hormone. And thyroid hormone controls your metabolism of your body. Oh, here you go. Maybe you have something else.
Maybe it's an allergy.
There you go.
And a lot of junk in the air. So what are some of the deficits to the body and to the brain if your thyroid isn't working properly?
Well, it's huge. And just a disclaimer, I have had Graves' disease, and it's an autoimmune disease. And it's one of those things that we've talked about many times. It's where your immune system has set up an immune response towards part of your body. It's attacking part of your body. And it can be a big deal. It's not uncommon that somebody has Graves' disease and they may not know it at first, but there's so many different symptoms. You can have anxiety, irritability, insomnia, fatigue. The biggest thing is fast or irregular heartbeat, which I can tell you all about. I mean, we're talking about, 100, 130, 150 beats a minute, and it doesn't go away. It's constant.
And what should the average heartbeat be at still resting, sitting down like you and I are now?
Well, and it depends upon your shape, but about 70s. So can you imagine having your heart rate double? And you've had it double before when you've exercised, but this doesn't go away. It's constant. So you're sweating, you have sensitivity to heat, you have weight loss, you may have a large goiter, your thyroid may be enlarged. There's so many different issues. You can have menstrual cycle issues. You can have ED or reduced libido, frequent bowel movements, diarrhea, exophthalmos, which is what we talked about briefly, the eyes. So you may see lines under the eyes, but more so the eyes are bulging. And it doesn't happen to everybody, but when it happens, it's called malignant exophthalmos, and your immune system is starting to attack, this is the theory, the connective tissue around the eyes and makes them bulge.
You said malignant. Is it a form of cancer by that?
No. What they mean by malignant is irreversible. So you've seen people whose eyes bulge.
Right.
A certain percentage of Graves' patients have that occur. And I was lucky I don't necessarily have that issue. You can have blurry vision. I mean, it can attack the eyes. And once it gets into the exophthalmos, it becomes a very difficult scenario. And sometimes there needs to be surgery to try and correct that issue.
I know that I had a friend who had Graves' disease, and they went in and actually made the sockets in his eyes larger.
Well, yeah. And
so he could see.
Sure. Because, it can distort vision due to the pressure. And, you've seen plenty of people with that, and it looks kind of funny as well, right? It looks like their eyes are really bulging out.
Right. Exactly. You said something. You said had Graves' disease. You no longer have it.
Well, theoretically, once you have an autoimmune disease, you always have an autoimmune disease. You always have that propensity. It's a matter of controlling it. And the reason today's topic is Graves' disease, because I was talking to a patient yesterday, and I realized we haven't done one, but it was very interesting in the conversation, and they're always the same, these conversations with patients with autoimmunity, is, we find out, okay, you've had Graves' disease, and what did you do about it, or what did the doctors do about it? And this one was pretty much the same as most, and there's a couple of different treatments. One of them, they give anti-thyroid medications to start to slow down how your thyroid produces thyroid hormone, which can actually help in a short period of time. And they don't do it for that long. In addition to that, they will give beta blockers to slow down the heart. And as time moves on, if it doesn't resolve, they will go towards radioactive iodine, because your thyroid has an affinity to iodine.
Right.
So it gets that radioactive iodine and it kills the thyroid. And,
oh my.
And then if that doesn't necessarily work, they'll do a surgical removal of the thyroid gland. And the big thing is that nothing that they're doing is treating the cause of the disease, right? It's kind of like you have your house is on fire and the fire alarm's going. Well, you have a couple options. Either you can put out the fire or you can unplug the alarm, right?
Right.
And removing the thyroid is like unplugging the alarm. It's not fixing anything.
So what you're talking about is that the traditional doctors tend to treat the symptoms rather than the cause.
Right. The problem isn't the thyroid. The problem's the immune system. And you have to work on the immune system, because you have a 70 to 90% likelihood of developing a second and third and so on autoimmune disease. And,
oh, wow.
And so thyroid autoimmunity is bad enough, but I would say it's probably nothing compared to rheumatoid arthritis, type 1 diabetes, MS, ALS. I mean, there's a whole laundry list of autoimmune diseases that you're 70 to 90% more likely to get because you already have one autoimmune disease, and you're not treating the root cause of the problem. You're just trying to chase symptoms.
So how do you, as a nutritionist and functional medicine specialist, how do you treat autoimmune diseases, and specifically Graves' disease?
Well, Graves' disease is tough, and it depends upon your what they call a thyroid storm. How fast is your heart rate going, right? I mean, there's only so much you can put up with. And if it's really, really bad, you really don't have a lot of options but to go on a beta blocker, right? I mean, beta blocker, it shouldn't be plan A, but sometimes you don't have a choice, because can you imagine your heart rate at 150 beats a minute nonstop, no matter what you do?
Wow, even sleeping.
No matter what you do.
Wow.
And it can go for weeks, it can go for months. You can't take it. You just can't. So sometimes you don't have a choice, beta blockers. But beta blockers come with their share of side effects, and you have to make sure that you're aware of those. The anti-thyroid medications may be helpful as well, as a measure to reduce the symptomology, but not necessarily treat the disease. And so sometimes you don't have a choice. Sometimes you do. Sometimes it's just a minor occurrence, whereas mine was pretty dramatic. I was under a great amount of stress. My diet was pretty clean, but there was certain things that I didn't have removed, like gluten, right? But my stress levels were huge. In fact, I used to go out cycling, and I'd ride between 30, 60 miles plus at any given point in time. And we're not talking about just riding slow. We're talking about hardcore cycling. And that, in addition to the other stresses on my system, it was too much. In addition to, there's genetic components, there's nutritional deficiencies, selenium deficiencies, sometimes carnitine can help. Infections, you have Yersinia, you have H. pylori in the gut, you have different gut infections that could create issues. Tooth infections, like low-grade tooth infections, herpes, Epstein-Barr, cytomegalovirus.
Wow. I'm going to assume that the bottom line is testing, and more testing to determine the cause of the Graves' disease as well as other autoimmune diseases, as we've talked about in the past.
Yeah, and it's testing not just, on the Graves' disease. Like I said, Graves' disease is just a symptom. You have to understand what's going on with the immune system. You have to look for infections. Are there low-grade infections that you don't even know about? Do you have vitamin D deficiency? Are you up on your omega-3s, which decrease inflammation? We talked about the gut microbiome, or the flora of the gut. That's really important. Do you have leaky gut? We have to test for leaky gut. What about genetics? There's a couple of different traits there. You have CLTA-4 and MTHFR, which we talked about. MTHFR has a 30% increase of thyroid autoimmunity. So, there's so many different things to consider. You also have to look at your adrenal glands. And it goes on and on and on.
And these situations can be tested?
Absolutely, they can be tested. But like I said, you're working on treating the immune system, not necessarily, you'll support the thyroid. And what's going to happen in time, usually, depending upon if you're able to tame the immune system, your body will end up destroying the thyroid. And at one point, you may become hypothyroid and need thyroid replacement hormone.
Wow. It would seem to me that what you're talking about is really hacking the immune system. And
Absolutely. And that's, like I said, I see it every day. I'm talking to people and they go, oh yeah, I was treated for Graves' or Hashimoto's, which is another thyroid autoimmune condition. But they were just treating the symptoms. Like I said, the big issue is 70 to 90% likelihood of getting another autoimmune disease. And that's big. That's huge.
I'm sorry, go ahead.
No, go ahead.
What kind of testing does a person need to go through to determine how bad or if they have Graves' disease, or for that matter, another autoimmune disease?
Well, there'll be a certain thyroid panel that will include autoimmune antibodies like TSI, TPO, in addition to looking at the thyroid hormone output itself. And a good doctor will know that and will test for that. Sometimes they don't, but usually hyperthyroidism is a big enough deal. Truly, when you have it, you think you're going to die. That's how bad this is, right? You're completely out of breath, wow. Everything. You can't even think straight, right? And so the medical treatment right from the beginning isn't a bad way to go if it's really advanced. If it's not advanced, there's other things that we can do.
And it can't 100% be reversed, but it can be contained, so to speak.
Well, once your body has that immune response, it always remembers that immune response for autoimmunity. We can control it. And if we can control it, we minimize your body's defense on the rest of your tissues. And so therefore, we can control the autoimmunity. And it's real important because, like I said, it's going to go somewhere else and do something else if you don't fix the problem. That's the big issue. So people aren't treating the cause. They're just treating the symptom.
And what would some of the things that a person who has beginning Graves' disease, they test positively, what should they do? A diet would be one thing that I know that you're going to tell us to do. What are some of the other things?
Well, diet is huge. When we talk about leaky gut, and we've done videos on leaky gut, but basically what's happening is your body is letting amino acid sequences that look a lot like your tissue parts. It's called molecular mimicry. And so we have to make sure that the gut is healthy. That's an important thing. So we have to look at the gut microbiome. We have to look at your adrenal glands as well. What kind of stress are you under? Are you moderating your stress? That's huge because stress is like the icing on the cake, right? You may have genetic predisposition, vitamin insufficiencies. You might have gut microbiome issues, and then you add stress on top of it. Now you have the perfect storm, or what you call even a thyroid storm.
How do you control your stress? You were telling us that you were cycling a lot. It would seem to me that, exercise, everybody's talking about the big E, that exercise would be a great way of controlling stress.
Well, at the same time, I was working like crazy, really, really hard. And in addition to, anytime I had a chance to get on the bicycle, Mark, I'm riding 60 plus miles, not like strolling, looking at the scenery. We were talking about full on, to a point where you've expelled all your minerals and your body cramps and you can't even move another muscle. I was going to that extent, doing racing, doing a lot of climbing, and it was too much. When you look at the adrenal glands, part of treating an adrenal issue is moderating your exercise. And I was not moderating exercise. I was hardcore all the way.
On Late Night Health recently, you mentioned that a lot of people over-exercise or even under-exercise. And you need to find a place right there in the middle so that it does the best for your brain and your body.
Right. And I didn't listen. Right? Your body tells you certain things for a reason. And I'm pretty strong-willed and hard-headed. And, yeah, I'm going to get up. I don't care what it's going to take. I'm going to get up and I'm going to do it. And so sometimes we tend not to listen. And men are probably a little bit more prone not to listen than women. But women are more prone to get this disease than men as well.
Got it. Oh, women get it more than men?
Yes, they do.
Oh, wow. Interesting. Well, anything else on this as we come to the end of our segment together?
No, I understand thyroid conditions. I have Graves' disease and I have Hashimoto's, which is a rare scenario to have both of them at the same time. And I know what it takes to tame that immune system. I've done it, and I've worked with.
And you do it.
And I do it. And I've worked with so many patients with it. The thing is, like I keep mentioning, you have to treat the cause and not just treat the symptom, because you will pay the price. It's just a matter of time. You're not fixing anything, right? It's just going to happen, and your body's going to keep doing more of what it was doing.
Well, you look terrific, and you can't even tell that you have these situations. If you would like to talk to Dr. Celaya in a free 15-minute consultation, absolutely free, no strings attached, go to his website, drcelaya.com, drcelaya.com. Also, take a look around, because in addition to videos and articles and blogs or some audios, you'll find out lots of information about how you can be healthy. Dr. Celaya, thanks for joining us here on Late Night Health. I'm Mark Allen, and we invite you to join us on Late Night Health at latenighthealth.com. I'm Mark Allen for Dr. Celaya. We'll see you next time. Bye-bye for now.